Good afternoon and welcome to this community briefing on our ongoing pandemic efforts. Providing interpretation for us today is Margie Propp. Thank you, Margie, and thanks to everyone for joining us to learn about the latest local developments. I want to say thanks to our community's commitment to disease and prevention efforts. We went back to yellow last week on the COVID-19 risk dial because of the continued improvement in our local situation. This week, the risk dial will stay in elevated yellow. Let's take a look at the latest data and what it's telling us. As we shared last week, the peak in the number of new cases reported in Lancaster County from the Delta surge was 1,024 for the week ending September 4th. Over the next 4 weeks, we experienced a steady decline in weekly cases, which went down to 587 for the week ending October 2nd. This was a 43% decrease in weekly cases. And over the last 2 weeks, however, from October 3rd through October 16th, we can see the decline has flattened at about 600 weekly cases. This is a situation we've seen before, a surge, then a decline, then a plateau before the case numbers drop again. This plateau effect is also reflected in the positivity rate, which has been in the 9 to 10% range for 5 straight weeks now. The positivity rate is an important indicator of spread in the community and is still too high. We want to see the positivity rate down in the 5 to 7% range to show the risk of transmission is lower. We have seen a slow and gradual decline in the number of COVID-19 patients hospitalized locally. The top blue line on this chart shows the gradual decline from an average high of 109 down to 93 at the end of last week. This is good news, but a daily average of 93 COVID-19 patients hospitalized is also too high, and local hospital capacity continues to be a serious concern for our community. Another concern is depicted by the orange line on the chart, which shows the number of Lancaster County residents who are hospitalized, and the yellow line, which shows the number of hospitalizations from outside the county. You can see that the number of local residents hospitalized, which has been showing a steady decline, started to go back up October 11th. Lancaster County residents now make up the majority of patients. Today, there are a total of 93 patients hospitalized, with 52 from Lancaster County. And deaths due to COVID-19 are a delayed indicator. That's why we may see an increase in deaths while other indicators improve. Sadly, we continue to lose more members of our community. A total of 17 deaths have been reported so far in October. That number includes 3 we're reporting today: a woman in her 60s who was unvaccinated and 2 men in their 70s who were vaccinated. Overall, many of the indicators used to determine risk have been moving in the right direction. However, the number of new cases and the positivity rate are still too high. We're not yet seeing the sustained declines we need to see. And hospital capacity and the number of COVID-19 deaths remain a serious concern. We continue to closely monitor our indicators and review the impact of our local situation. It's important as we are in this plateau with our indicators that we continue to be patient. If we stay focused on what we need to do, further decrease the risk of COVID-19 in our community, we will see our numbers go down. We know we can do this because we've done it before. And we have 2 main strategies we've been using to achieve this. One is wearing masks. Masking is a proven strategy that reduces the spread of the virus. The second strategy is a safe and effective vaccine, which again is proven to reduce severe illness, hospitalization, and deaths due to COVID-19. We are very close to reaching our initial goal of 75% of Lancaster County residents aged 16 and older being fully vaccinated. We're currently at 74.7% and expect to hit that milestone either later this week or early next. Since COVID-19 vaccine became available in mid-December of last year, we've seen a tremendous response from our community and partners. Achieving this milestone will give us reassurance that we've been able to reach and help protect a significant proportion of our population through vaccination. After the initial rollout of vaccine, children ages 12 to 15 became eligible to receive vaccine in May. Vaccine approval for children 5 to 11 years old is likely to come in the near future, and that will add about 29,000 people to the list of those who are eligible for vaccine. The health department's next focus will be to have 75% of Lancaster County's entire population fully vaccinated. Right now, we're just over 60% of our 319,000 residents that are fully vaccinated. The CDC just released updated national data on the effectiveness of the vaccines in preventing COVID-19 cases and deaths. This first chart shows the risk ratio of testing positive for COVID-19. People who are unvaccinated had 6.1 times greater risk of testing positive for the virus than those who were vaccinated. The second chart you're seeing shows that people who were unvaccinated had an 11.3 times greater risk of dying from COVID-19 than those who were vaccinated. Clearly, those who are experiencing some of the most severe outcomes are people who are unvaccinated. We urge everyone who is eligible to get vaccinated as soon as possible. Ensuring that our residents have ongoing and convenient opportunities to receive vaccine remains a top priority. People in our community are getting vaccinated every day, and we continue to work with various partners to host clinics so you can get a first dose, a second dose, or a booster to enhance existing protection against COVID-19. Pfizer booster doses are currently approved for people 65 and older, residents in long-term care facilities, people ages 18 to 64 with underlying medical conditions that put them at higher risk of severe outcomes from COVID-19, and for people who work or live in high-risk settings. Right now, the booster dose recommendation only applies to people who have received 2 doses of Pfizer vaccine, and the booster is given at least 6 months after the second dose. The potential booster recommendations for Moderna and Johnson & Johnson are in process. Late last week, a Food and Drug Administration advisory panel endorsed booster doses of Moderna and J&J vaccine. The next step is for the FDA to decide whether to authorize the boosters, and if so, the CDC will then make a final decision. We are monitoring new developments closely and will provide more information as soon as it becomes available. For booster doses, we're using an approach similar to the initial rollout of the COVID-19 vaccine, moving through age and priority groups and stages. We're currently offering booster doses to people 65 and older, first responders, educators, and child care providers. The health department is contacting people in these groups to schedule appointments. Last Saturday, the health department held a large booster clinic for educators and child care providers at Southeast High School. This week, we have 2 more large clinics for those groups. One is tomorrow at Pinnacle Bank Arena, and the other is Saturday at North Star High School. We are working with our community partners to provide booster doses at some neighborhood clinics as well. Booster doses will be offered at 2 clinics on Thursday, one at the Asian Community and Cultural Center from 10 to 1, and another at the F Street Community Center from 5 to 8 p.m. Booster doses will also be offered on Friday and Monday at the health department from 9 a.m. to 2 p.m. So far, around 7,100 people have received booster doses at the health department and partner clinics. Several local pharmacies are also providing Pfizer booster doses to all ages and groups who are eligible. You can find a pharmacy near you at vaccines.gov or by texting your zip code to 438-829. Finally, we want to remind everyone that as the temperatures start to cool down, we will all start to spend more time indoors, which can increase transmission of COVID-19. It is important to be mindful of your surroundings and take the appropriate preventative measures, like wearing a mask. And it's also flu season. Flu vaccine is recommended for everyone 6 months and older and is widely available in our community. Getting flu vaccine provides protection from the virus and helps preserve hospital capacity during the pandemic. Masking and some of the other measures that help provide protection against COVID-19 will also help protect you from the flu. And with that, we'll take any questions.
Hi, Pat. It's Matt Olberding, the Journal Star. Hi, I just have a couple of questions for you. One, you mentioned there at the very end, getting ready for colder weather, and we've got cases kind of plateauing still at a fairly high level. So how concerned are you that as more people go inside, spend more time inside, that transmission will, or those cases will start to go back up?
Now, that is a real concern for us right now, Matt. And, it's hard to predict what will happen, and that's why we want to, express concern and that people use caution and use the available tools that they have. And that's, again, where vaccine plays an important role. But going back inside is something that we are concerned about.
And then that sort of dovetails with my second question with vaccines. In looking at the numbers on the dashboard, the last 2 weeks have been the lowest numbers for initial vaccines, first vaccines of the entire time they've been available. I mean, how do you feel like that? Is that a reflection that most people who are going to get a vaccine or who want a vaccine at this point have pretty much taken advantage, or do you feel there's still a lot of people out there who need to be reached with outreach and education and things like that, and there's still a lot of people there to get?
We're still working on outreach and education every day in a variety of ways, and we're also working with several partners to do the same. We have seen the interesting thing, while part of that remains flat, at some of the booster clinics, we've actually seen people come in for their first dose, which is really encouraging, even though we're not at the numbers we still really want to be, Matt. But we're going to continue to work forward. Our concern is the safety of those individuals, and we know that vaccine really makes a difference in the impact of the illness related and the possibility of hospitalization or more severe outcomes.
And are you guys planning any kind of additional or special outreach to the younger age groups where the vaccine rates are still pretty low, especially that kind of college age group, the 16 to 24 there?
Yes, we are. We're continued, and we're working with higher education groups and some others to reach out to that group to get vaccinated. I think part of the comments we still get from some individuals in that age group is they feel they're healthy and that they really don't think it's going to impact them. And what they don't realize, even though they may get COVID and maybe they won't be as ill, but that's not what we're necessarily seeing anymore, especially with Delta. But they're also then exposing others, and it could be some of the other loved ones who might be older in their family who could have definitely different outcomes. So that's part of what we hear. People think they're healthy, and the other thing is, I often hear, well, I just didn't get around to it, until something impacts them, and we don't want to see that happen. We want to go for prevention.
Okay, thank you.
Mm-hmm. Okay. All right. Thanks again for joining us today, and please be sure and wear your mask and get vaccinated.